I am Dr. Robert Davis with Active Health Knee and Shoulder, and I am here to go over some questions that have been asked recently regarding the pitfalls or negatives of having knee replacement surgery. So in all surgeries, number one, there is risk. So that's one pitfall, that's one negative in getting your knee replaced, is that you're going to have to undergo anesthesia, and there's always a risk in getting surgery. The other big risk is that it's not going to work, or it could be worse than it was before you actually had the surgery done. So we've been working on many people that have had surgery. A lot of the patients that come into my office have already had their knee replaced. I would much rather you come into my office, seek out a non-invasive approach before you have the knee replacement. You're always going to get better results if we're working on your natural knee. If you had a knee replacement and you're still having problems, absolutely call our office and get a consult. And this is why. If you're still having problems with the knee, that means that they didn't correct the original problem. They didn't correct the cause of the problem. By putting a prosthetic knee in your leg, it doesn't correct the power problem. And in most cases, in our office, I would say at least 90% of the cases, people have come in here told by more than one doctor a lot of the times as well, that their only solution for their chronic degenerative knee pain is to have their knee replaced. And that is not the case. Because of this, if your brain is controlling everything that's going on in your legs, for instance, I would never do this to you, but if we cut all the nerves that go into both your legs, what happens to your legs? Nothing. You can't get up, right? There's no power going to your legs. So that's an extreme example. But what happens if there's interference with the nerve energy? Okay, the nerve energy coming from the brain. So let's talk about your right knee. Left side of your brain sends signals down the spinal cord, and it runs across these nerves to innervate the muscles in your leg. So we're talking about two different nerves here. We're talking about your sciatic nerve right here that's going to run into the back of the knee, and that innervates your popliteus muscle. And the popliteus muscle is the muscle that unlocks your knee. And then we're talking about your femoral nerve, which is going to run into the quadricep muscles and also a hip rotator. So everything having to do with unlocking your knee so that it articulates, it bends properly. The hinge actually unlocks first and then it bends, and then also extending your knee. Sciatic nerve is going to unlock the knee, changes names, goes into the back of your leg here to innervate the popliteus muscle. Femoral nerve is innervating the quadricep muscles that will extend your knee. This is how your knee works. You want to take a step, the power comes from left side of your brain, running down spinal cord across these nerves to your knee. Here's the problem. If you don't correct this power source problem, which we do with a non-surgical operation, that's what we do in the office to reset this, you can go ahead and have your knee replaced, but if this is the original problem, you didn't correct the problem. So you still have a bad power source problem. That means your prosthetic knee, and on average, I believe it's 9-10 years that prosthetic knees actually last. Now you still have a knee that's not unlocking properly. Even though it's prosthetic, it's still not unlocking properly. It's still shearing together, and then you end up having the same pain problems that you had with your natural knee. So that is the biggest pitfall, that they put a new prosthetic knee in your leg, but they never corrected the original cause of the problem. And if this is the scenario, it's a power source problem. It's a loss of tone. Knee joint does not unlock properly. It stops articulating properly, and it wears down. And the wearing down of any joint, whether it's your natural knee or prosthetic knee, you're going to feel pain. There will be a pain reflex. You will feel pain, and it'll let you know something's going wrong in your knee. So that's it. It's the pitfall or negatives of getting your knee replaced is that they don't actually correct the real problem, which is a power source problem most of the time.